Hi, this is Dr. Paul, and we're talking with Dr. Garrett Bode. He's a chiropractic physician right here in Oldsmar, Florida. And the topic we're talking about are what are some of the common therapies that Dr. Bode uses to alleviate neck pain. So how about that, Dr. Bode? What are some of the common therapies you would use to relieve neck pain?
In our office, we're lucky that we have several different therapies that we can utilize for patients when they come through our office. And depending upon what's causing their neck pain, we're going to apply the therapy that's most applicable to them. I guess to run through a quick list with you, the therapies that we do utilize are going to be things like chiropractic adjustments, interferential therapy, electric muscle therapy, intersegmental traction, massage, spinal decompression, or maybe even physical therapy, depending upon what the condition is.
So you have quite an array of therapies. And what's the short list of the common problems that you'll see that are causing neck pain, first of all?
Short list is going to be the most common causes are going to be things like joint disorders, arthritis, inflammation within the joint, disc problems, either disc bulges or even disc herniations, or even pinched nerves, which are very common as well, usually typically due to a misalignment.
Well, if you don't mind, can we go through each one of your therapies a little bit and explain a little bit about which they do? So what's one of the common therapies you would use with a neck condition?
One of the common therapies we're going to use obviously is heat or ice, and that's always going to depend upon the patient.
Actually, I'm glad you said that. What's the difference using heat or ice with their condition?
Ice is always going to be used with a new condition, something you just did, you just injured it. Even if it's an old condition that you've re-injured and it's re-irritated, ice is always going to be your best form of therapy. If it's an old condition that is not necessarily re-injured but just stiff and maybe a little sore, then heat is a good form of therapy.
So you'll use those therapies here in your office?
Absolutely.
Okay, and what else were you saying?
We said interferential therapy. Interferential therapy is utilized as almost a way of blocking the pain that the patient is having with the electricity. So we call it a electrical nerve block, basically, if you'll allow, and that's a way to block the pain while the patient's on that therapy. And because it is blocking that pain, it's very comfortable and relaxing for the patient while they're doing it.
Okay, and so it sounds like the interferential therapy is specifically used for pain relief.
Absolutely.
Okay, and another therapy would be?
We said ultrasound. Ultrasound is a type of therapy that you'll utilize to increase the heat to an area of the spine. So if a patient is having, will also increase blood flow. If a patient is having a chronic condition or stiffness or has excess scar tissue, then ultrasound would help tremendously in helping to alleviate some of that symptom.
Now what's happening? So when somebody gets ultrasound, what happens?
Ultrasound is basically you have a sound head, and that's the type of way it delivers the sound waves into the body. It's a different type of energy that is used as opposed to a woman maybe getting a sonogram of their child. It's a different type of ultrasound that you're doing. It's basically just a different frequency or wavelength of the sound. One is a diagnostic, the other is a therapeutic type. And the ultrasound that we utilize here is a therapeutic type of ultrasound.
So it's really sound waves that's going in that's producing this heating effect.
That's correct.
And what are you trying to accomplish when you're applying this deep heat of ultrasound? What are you trying to accomplish?
You're trying to accomplish basically giving alleviation of the patient's symptoms, pains, or issues that they're occurring. There's certain conditions that are specifically better off with ultrasound, and others that you may be looking to a different type of therapy. Maybe something along the lines of spinal decompression, which is something that we utilize for disc injuries.
Now, is that something you can use for a disc injury in the neck?
Spinal decompression, absolutely.
Okay.
We've had several patients and have had great success.
And how does that work?
Spinal decompression is basically where you take the patient and you pull the patient apart axially, meaning it would be, for me and my neck pain, the machine would grab a hold here and lift very gently on my head.
So it's not painful?
It's not painful at all. Most of the time patients are asleep when I come to get them off the therapy. But in lifting that pressure off, you're lifting the pressure off of the disc itself, therefore alleviating the symptom, not making it worse. So it's a nice pain relief while the patient is going through the therapy.
So it sounds like, and correct me if I'm wrong here, it sounds like the spinal decompression is specifically for disc-related neck.
Any type of disc issue, that's what you're going to utilize the spinal decompression for.
Okay. And what's the difference between spinal decompression and traction?
Traction is, well, it depends on what type of traction. Some of these nomenclatures or words are kind of thrown around very casually, but intersegmental traction is a type of therapy where you're basically on a specific table that stretches the muscles and ligaments and tendons of the spine. But it stretches it by putting pressure into the spine while the patient is lying flat on their back.
Right.
There's a difference in that and something that pulls the patient apart long ways as opposed to something that pushes up into the spine. There's your difference, is what they're trying to accomplish. Decompression is to help a disc. Intersegmental traction is more for stretching and opening up the spine.
Okay. So we covered quite a bit. We covered chiropractic adjustments can help for the neck. We covered ultrasound, intersegmental traction you just talked about. We just talked about spinal decompression. We talked about interferential current. What are any other therapies that you...
A couple other therapies we do, like you did mention, we do the chiropractic adjustments, realigning the bones of the spine. We also utilize physical therapy, resistance types exercises to help strengthen the muscles and ligaments of the neck if they've had some type of injury. And another thing that we'll utilize is massage. Patients love massage, but not only that, I love massage for what it does for the patient, strengthening and stretching the muscle at the same time while also increasing the blood flow. That promotes healing. And once you've stretched the spine, it makes those adjustments much, much easier and much, much more effective.
Is massage something that you'll commonly use with neck pain type of conditions?
It is something we use pretty common, although it's always going to depend upon the patient in front of us and what their particular condition is.
Okay. So you have quite an array here. You've got chiropractic adjustments for neck pain. You've got chiropractic adjustments. Help me out here. You've got ultrasound. You've got massage.
We have electric muscle stim. We have decompression. We have chiropractic. And we actually have physical therapy here as well.
Okay. So you have quite a few therapies to help patients with various conditions of neck pain. Does that sound like a fair statement?
We try to do our best to give as many tools in our bag to be able to help any patient that may come through our door.
Okay. All right. Very good. All right. Again, we're talking with Dr. Garrett Bode. He's a chiropractor right here in Oldsmar, Florida. And obviously, if you're having any neck pain, obviously he has quite a few therapies to help you. Go ahead and give him a call.